Even after a full night's sleep, you wake up exhausted. Your legs feel heavy, your skin looks older, and your energy is never quite enough. The blood tests are constantly changing, the diet is confusing, and you're told to just manage it, but something feels wrong on the inside. It's not just the numbers, it's the way your body isn't healing, your nerves are acting up, or your weight won't go away no matter how hard you try. What if the real struggle isn't just sugar? What if your cells are starved not of calories, but of the essential nutrients they need to protect you from the damage that diabetes silently causes every day? There are 3 vitamins that your diabetic body uses up more quickly than others. They not only help you stay healthy, but they also protect your nerves, heart, and desire for life and love. When these are depleted, no medication, exercise, or ideal diet will feel sufficient. This is about healing from the inside out, starting with the nutrients your body is subtly pleading for. Let's start with vitamin C, which most diabetics carry around with a hidden deficiency that hardly anyone discusses. Yes, this isn't just about immunity, it's about your nerves, kidneys, eyes, heart, and even your sexual life. Unfortunately, vitamin C is naturally lost by diabetics without their knowledge. It leaks through their urine, but is unable to enter their cells, causing the body to starve at the tissue level even when their diet appears to be healthy. This is known as a functional deficiency, and in diabetics, it can reach as high as 30 to 40%. Vitamin C competes with glucose for entry into the cells. Your eyes may feel weary, your vision may become hazy, or you may notice tingling, burning, or poor wound healing, even if your blood levels appear normal. You may also detect floaters. When vitamin C deficiency creeps in, it impairs collagen synthesis, slows down immunological restoration, and causes blood vessels to become weak and inflammatory. Your gums may bleed more easily, cuts take longer to heal, and your skin begins to look drab and age. Diabetes also affects the kidneys because insufficient vitamin C causes greater oxidative stress in the nephrons, which accelerates the loss of protein in the urine, stiffens the heart, hardens the arteries, and reduces circulation. Because vitamin C is necessary for nitric oxide synthesis and blood vessel dilatation, libido also declines. Men experience performance weakness, women feel alienated, and both sexes sense their desire subtly vanishing at the cellular level. Weight loss also slows down with vitamin C deficiency because vitamin C is a coactor in enzyme systems that reduce free radicals, regenerate other antioxidants like vitamin E, and support the synthesis of carnitine for energy inside the endothelial lining. It also regulates nitric oxide, keeping vessels relaxed and open inside the pancreas. It protects beta cells from oxidative stress, which improves insulin release in the brain. It also aids in the synthesis of dopamine, which affects mood and motivation. Diabetics become caught in this metabolic cycle without even understanding it's a dietary problem, which makes their energy levels drop and their cravings, particularly for sugar, increase. Now, let's talk about food. 1 cup of chopped kiwi gives you about 170% of the daily value, or 120 g. 1 cup of red bell peppers gives you about 120 g. 1 cup of guava gives you about 140%, or 55 g. Strawberries give you about 90%, or 150 g. And oranges give you about 85% in a medium fruit of 130 g. These are not just fruits. When used, they are medicinal meals for diabetics. Now, let's indulge in a little luxury. First, a 250 Dungeon serving of tropical ceviche with fresh guava, lime, and wild-caught tuna provides more than 300% of your daily vitamin C. Second, a chilled strawberry kiwi gazpacho made with crushed basil Greek yogurt and raw honey. About 200% of the daily value can be obtained in a 200-gram bowl. Third, a salad of smoked salmon, avocado, lemon zest, pumpkin seeds, and roasted bell peppers. A 280-gram portion contains 250% vitamin C and beneficial lipids that enhance absorption. Since cooking reduces vitamin C's bioavailability, raw or lightly steamed foods have higher bioavailability. Fresher produce has a greater retention rate. If you're taking supplements, the two best forms are liposomal vitamin C and sodium ascorbate. Liposomal vitamin C, which typically comes in 1,000 milligram packets, absorbed more quickly through fat transport and raises blood levels. However, reheating and cold storage negate much of the benefits. For diabetics who are sensitive, a 500 milligram capsule of sodium ascorbate is kinder to the stomach and better for long-term support. The ideal dosage for diabetics is 1,000 to 2,000 milligrams daily, divided into 2 servings in the morning and evening. Foods that spike blood sugar and prevent vitamin C from entering cells make the deficiency worse, even when intake is high. If you are eating bell peppers and drinking orange juice, but still have nerve pain, gum bleeding, or low energy, you are probably functionally deficient. And if you have diabetes, this vitamin could be the difference between a stable recovery and everyday complications. In addition to preventing colds, vitamin C is essential for maintaining healthy kidneys, healthy nerves, relaxed blood vessels, a strong libido, and weight loss going forward. If this helps, please leave a comment. If not, please leave a 0, share, and subscribe to help us grow. Let's move on to number 2. Even if your lab results indicate otherwise, if you have diabetes, your body is probably deficient in vitamin D. This is more dangerous than it may seem. A vitamin D shortage affects around 80% of diabetics, yet the majority are unaware of it. But the true issue isn't just a lack of sunlight. Diabetes itself prevents the body from activating and using vitamin D where it's needed. Most kidneys that convert vitamin D into its active form begin to fail early in the disease, slowing down the entire pathway. If you are overweight, as many diabetics are, your vitamin D becomes trapped in fat cells and becomes unavailable. Chronic inflammation, high blood sugar, and oxidative stress further weaken your body's vitamin D receptors. So even if the vitamin is in your blood, your cells can't use it correctly. This is known as functional deficiency, and it's one of the silent causes of diabetic complications. How are you aware that it's taking place? You have deep belly fat that won't go away. Your bones hurt, your muscles feel weak, and you feel exhausted even after getting enough sleep. Libido begins to decline for males. For women, this manifests as a decreased testosterone response. Fertility may decline, particularly if mood swings or insulin resistance are increasing if weight is excessive. If you're experiencing frequent infections, symptoms like hair loss, cognitive fog, and a weakened immune system are all indicators that something more serious is amiss. Low vitamin D may be the cause of nerve symptoms, including burning feet, restless legs, and pins and needles, as well as feelings of emotional flatness or weight gain despite dieting. Without vitamin D, your heart pumps harder because the vessels become stiff and inflamed, your eyes are unable to regulate pressure properly, and your kidneys deteriorate more quickly because it supports nerve growth factor and reduces inflammation in the nervous system. This raises the risk of diabetic retinopathy inside the cells. In addition to being a vitamin, vitamin D functions as a hormone by turning on and off genes that regulate inflammation, blood pressure, insulin production, and immune balance in diabetics. It also increases insulin receptor sensitivity, which facilitates glucose uptake by cells and shields your pancreatic beta cells from oxidative stress, preserving the body's capacity to produce insulin in your blood vessels. Slow weight loss results from vitamin D insufficiency because it regulates the amount of fat that is stored versus burned, lowers angiotensin, which prevents blood pressure from rising in your fat cells, and controls the synthesis of nitric oxide, which decreases stiffness and improves blood flow. Reduced metabolic adaptability and increased accumulation of abdominal fat. Now, let's discuss food. 1 tablespoon of cod liver oil has 135% of your daily vitamin D, making it the best option. Fortified egg yolks provide around 10% per big egg, whereas 14 German of wild salmon gives you about 70% in a 3-ounce amount. 85 grams of sardines give you about 45% in a 2-ounce chunk, or 56 grams of mackerel gives you about 55% in a 3-ounce portion. These meals also contain natural lipids that improve absorption, with 2 eggs providing 20%. However, if you don't consume them frequently or cook them at high temperatures, you may lose a significant portion of the benefits. Bioavailability is dependent on the meal's fat content. If fat absorption is less than 50%, bioavailability will decrease. For the luxury first, a Nordic-style plate of wild salmon with poached egg and cod liver sauce served over lightly sautéed spinach and avocado provides 180% of your recommended intake of vitamin D, which is why dry, fat-free meals that are high in vitamin D don't work well. A side of sardine-stuffed olives and a soft-boiled omega-3 egg lemon herb dressing accompany the second Mediterranean grilled mackerel. More than 160% of the daily value is provided by a 250-gram plate. Third, sardines wrapped in seaweed and served cold with ponzu and sesame oil, accompanied with salmon sashimi topped with cod liver dripping and quail eggs. More than 70% of the daily value is provided by a 200g meal. Vitamin D3 with K2 and emulsified liquid D3 are the 2 greatest solutions for diabetics when it comes to supplements. Each recipe maintains the integrity of the fats and improves absorption with citrus oils and gentle cooking methods. For diabetics who are prone to artery calcification, the D3K2 blend, which normally contains 5,000 IU of vitamin D3 and 100 micrograms of K2MK7, encourages calcium direction into bones rather than arteries. When taken with meals that contain fat, such as fish, olive oil, eggs, or avocado, emulsified liquid D3, which is typically dosed at 1,000 IU per drop, provides greater absorption for people with digestive problems or fat malabsorption. If you have low energy, poor sleep, rising blood pressure, or stagnant weight, avoid taking vitamin D with drink, processed snacks, or sugar-filled foods, as these increase inflammation and block the vitamin D receptor, making the shortage worse even when you're taking supplements. No matter what you do, vitamin D might be the ingredient your body needs to not only feel better, but also stop the damage diabetes is subtly causing to your heart, kidneys, and chickens, and nerves. 3-vitamin E may be the most underappreciated nutrient that keeps your body together. When it's lacking, the damage begins subtly, with nerve tingling, dry eyes, poor healing, and a slow metabolism. Blood pressure then rises, cholesterol rises, kidney function declines, and circulation drops in places you don't want it to. The worst part is that diabetics are up to 60% more likely to have a vitamin E deficiency even when they eat enough. The deeper issue is absorption. Vitamin E is fat soluble, meaning you need healthy bile, gut function, and dietary fat to absorb it. However, diabetics frequently have sluggish bile, fatty liver, pancreatic issues, or intestinal inflammation that blocks fat absorption. Additionally, high sugar damages lipoproteins in the blood that carry vitamin E to your tissues, so your blood may contain some vitamin E. This is because diabetes increases oxidative stress, and vitamin E is the first antioxidant to burn it out. However, your cells continue to hunger. This is known as a delivery problem, which is why symptoms of a shortage may appear before lab results drop. Your nerves begin to malfunction, and you experience numbness, burning in your legs, or restlessness. Your kidneys lose antioxidant protection after screen time, which accelerates scarring and filtration loss, and your eyes get dry, strained, or unfocused. Your arteries get stiffer and your blood flow becomes weaker, increasing the risk of heart disease. Because vitamin E promotes nitric oxide and blood vessel flexibility, libido also declines. Women frequently feel vaginal dryness, low desire, and emotional alienation within the cell, and males may observe poorer performance. Vitamin E serves as a membrane shield, protecting mitochondrial membranes, preventing oxidation of fats in cell walls, balancing inflammatory signals like prostaglandins, and minimizing damage to cells from free radicals. When vitamin E levels are low, inflammation increases, insulin sensitivity decreases, and fat metabolism slows. This is why weight loss can feel stuck even when you're doing everything right, because your body is unable to defend itself against the stress that diabetes causes. It also supports the regeneration of other antioxidants like vitamin C and glutathione, which diabetics depend on for insulin function and nerve repair. The best food sources of vitamin E are frequently overlooked. Almonds provide almost 48% of the recommended intake in the same serving, whereas sunflower seeds provide 37% in just 1 ounce, or 28 grams. Extra virgin olive oil contains roughly 13% per tablespoon. Hazelnuts provide 28% per ounce, and avocados give you 14% per half of fruit, or 100 grams. Since these sources are fat-based, when combined with other whole foods, their absorption is significantly increased. Roasting nuts at high temperatures can reduce their vitamin E concentration by 20 to 30%, while frying oils at high degrees eliminate the majority of their antioxidant qualities. Bioavailability is strong when consumed raw or barely heated. The first dish on the upscale table is Mediterranean grilled eggplant with avocado, tahini sauce, toasted almonds, and a drizzle of cold-pressed olive oil. A 300-gram portion of Moroccan lamb tagine with braised figs, hazelnut couscous, cinnamon, and olive oil provides about 65% of the recommended intake of vitamin E, while a 280-jar dish gives more than 70%. In a 200-jar bowl, the third chilled sunflower seed gazpacho with green grapes, parsley, and avocado foam provides more than 90% of the daily value. These dishes incorporate natural plant fats, herbs, and antioxidant-rich oils that improve absorption and digestion when combined with 2 types of combined tocopherols and tocotrienols in a unique way. Full-spectrum protection that resembles food is usually provided by 400 IU per soft gel. This type targets the immune system, heart, and nerves. Alpha tocopherol soft gels, which contain 200-400 IU, are the best for short-term antioxidant defense. Both forms are best taken with meals high in healthy fat, such as avocado or fatty fish with olive oil for lunch or dinner. Do not take it with trans fats or sweets, soda, or processed grains. These foods oxidize blood lipids and prevent the transit of vitamin E, which is how deficiencies worsen even when a diet appears to be healthy. If you experience a decline in libido, a rise in blood pressure, or a loss of energy, for diabetics, this may not be about hormones or aging, but rather a silent vitamin E crash occurring inside their tissues. This isn't a bonus supplement. Rather, it's cellular protection, metabolic fuel, and reproductive strength all combined into one potent antioxidant that your body uses every second. Don't wait for damage to appear. Fix the root. You fought hard through every test, craving, and silent concern about what might happen next. The truth is that your body wants to heal, not break down. And sometimes it's about giving your body what it needs. These nutrients aren't extras, they're lifelines that repair what diabetes tries to destroy. If you've been feeling exhausted, stuck, or invisible, know that there is still more healing left in you, and it begins with the simple things your cells are silently pleading for. If that feels familiar, please like, subscribe, and share. They protect your heart, calm your nerves, revive your energy, and help you feel like yourself again. This isn't about chasing perfection, it's about giving your body a genuine chance.